Hi, I'm Marisa Medina from the Benioff Children's Hospital in Oakland. And today my question for you is, should you take a statin? Should your patient, your parent, your neighbor, should they take a statin? Cardiovascular disease is a leading cause of death in the United States. And for the past 3 decades, statins have been the standard line of treatment for the prevention of heart attacks. But they don't work in everyone, and they have side effects. And so what do I mean by that? Let's say we took 40 people who all have known heart disease. So these are all people who are at high risk for having heart attacks and therefore you think should be on a statin. Over the course of 5 years of statin treatment, some of them will have a heart attack despite the fact they took a drug. Some of them will develop such severe muscle pain they'll stop taking their statin. Some of them will develop statin-induced diabetes. The majority of them won't have a heart attack, but it turns out they wouldn't have had one irrespective of whether or not they took the drug. In fact, only 1 out of those 40 statin users will have his or her heart attack prevented because of the drug. That is 1 out of 40 high-risk patients. I recently asked a conference room full of people, who here knows someone, yourself included, who is currently on a statin? And it was remarkable when almost the entire room had their hands raised. Especially when you think about that statistic, 1 lucky winner out of 40 statin users. We hear the term precision medicine used a lot, but to me it means this. Imagine if I could tell you, as an individual, or your patient, or your parent, or your neighbor, whether or not you will actually benefit from a statin, or whether you'll have a bad outcome. And if you consider the fact that there are currently 56 million Americans who are eligible for statin treatment, you can see how if we had a diagnostic test that could predict outcome on statin, that this would have a tremendous public health benefit. And so that's the goal of my research. First, to identify a molecular test that can distinguish who will have a bad outcome on statin versus those who won't. And secondarily, to understand the underlying biology which led to that bad outcome. So how do we get there? In collaboration with Kaiser, we have identified and recruited over 700 statin users who've had one of those 3 bad outcomes, meaning a heart attack on drug, severe muscle pain, or statin-induced diabetes, or none of them. We've made cell lines from each of these individuals, treated them with statins, and then looked for changes in gene expression and metabolites to ask, well, is there a signature profile that differs between, say, someone who developed statin-induced diabetes versus someone who did not? Although we're still in the process of creating and profiling these cell lines, we are very excited about preliminary results, which suggest that individuals who develop statin-induced diabetes handle fats differently while on treatment compared to those who don't. We're now taking these hypotheses back to the lab to test them in cellular and animal models, again toward the hope of not only creating a diagnostic test, but also learning some new biology which can lead to improved cardiovascular disease treatments. Because it is my hope that in the future, if I ask a room full of people who here knows someone who is on a statin, that I'll see only a few hands raised, because only those people who actually will benefit from the drug will be on the drug.